everything was absolutely normal, nothing is there. He and his cousin were playing in the garden, and suddenly this was the history came afterward, but the child came, and at the 4:30 or 5 o'clock, the child got sudden fever, and child went into a state of what we called as a sleeplessness or a sleepiness, severe sleepiness. So mother was worried that my child was so much so restless and active, and how can this child can be sleepy in this evening. So the mother, child, and one of the cousin come to clinic at 6:30. So I ask about something. What happened? What happened? So the accompanied child says that we were playing in garden, and suddenly a dog came, and we were doing mischief with the dog. So dog was barking and dog running behind that child. So this is what we called as the dog was barking and running behind child. The child got into a state of fright, and that fright lead to a fever and what we called as overpowering sleep. What was the remedy? Yes, Suha Sonamne, it can be aconite. Very good. Yes, Farhan Khan, absolutely
Opium.
right. I had prescribed opium in that case, opium 200. Next day, child was absolutely fever free. So this is what you have to encounter when you came across any of the out of control emotions or any of the out of control reactions. Another case which I am sharing with here is the case of a child came to me after the next day of his birthday party. So the girl of around 7 years old came to me with the parents, and parents says that this child is having fever, and this child also goes into a state of dullness and sleepiness. So I ask about what happened, anything, any anger, any fright. So everyone says nothing, nothing, nothing. And in spite that father says that yesterday her birthday was there, and she was so much so excited about her birthday and everything. So I asked what happened in birthday. Anyone scold him? So obviously we ask about negative emotions. Okay, but we cannot ask about any of the positive emotions. Okay. So in that case, I asked about something's happening happen. So father says that she wished to have a good toy, and we were given a surprise without knowing her that this toy is bring to her. So she was so much so excited, and she slept after that excitement, and suddenly in the morning she got a fever. So same way. Absolutely, all are giving a wonderful remedy, coffea.
Coffee, sir.
Unfortunately, I had not prescribed coffea. I have prescribed opium again in the same case. Ailment from joy. Absolutely right. So, ailment from joy. So, this is what any of the out of control emotions or its reaction to be taken into psoro-syphilitic conditions. Hope you got the idea from these examples. So you can find out any out of control reactions in terms of either delirious conditions, in terms of either anguish, in terms of either a panic state, everything. One of the child came to me with the complaint of a fever, and during fever he used to have a crying, very important crying, and that cry was very mild, and always having there is a tear drop came from the eyes. So by looking at this, we can prescribe the remedy, that is a mild cry with tear in the eyes in the acute. So I prescribe pulsatilla on the basis of that. So this is what you have to observe in each and every cases, so that you can get the right remedy from this point. So be it clear, when you have acute conditions, you have to look only and only for this phenomena. Take these pictures, very important. Okay, hope all get idea about that. I must need interaction, so that, yeah, great, good. So we are going gradually evolving. So at the end of sessions, it is from basic to the highest. Okay, fine, great. So going for further, so this is called as, it is not a GCS. This is called as an acute remedy. This is called as a state remedy. This is not a GCS. Okay. So keep in mind what we learn from the sir. In an acute condition of any of this, any damn remedy comes from the materia medica. Okay. Any damn remedy comes from the materia medica. I must remember one of the case of my friend Dr. Nishant. In his clinic, one child came at almost around 12 noon with the complaint of weird behavior and something a maniacal behavior or weird behavior, and the orientation of the child is disturbed. Okay, so orientation of the child is disturbed and goes into a state of what we call as a delirium. So on inquiring everything, my friend did not find anything out of it. But father says the child was brought by the father. So father said that the we went to he had a little refractory error and eye problem. He cannot see in the school. So we went to eye specialist. And after checking the number at 11 o'clock, at 12:30 he developed this type of behavior, and at 12:30 the patient landed into clinic that something is happened after this. So what could be the thought process in your mind? Any guesses? I think one of my friend is joined, so if he is there, he knows everything. Is Nishant is there? Yeah, Nishant is there. Yes. Dr. Sucheta, eye drops was put for the eye checkup. So what could be the inference from this? Absolutely, your thought process is regarding this. We have to encounter any of the cause. It can be mental cause. Yes, pride can be one of the reasons. But don't directly jump from the remedy, Dr. Monica, because when we jump to the remedy, no, we cannot understand the process. We just understand the remedy. Okay. Yes, we can think of injury from allopathy medicine. Which remedy to be prescribed, Doctor? I think Dr. KG has given answer. Which remedy to be? Nux vomica? Yes, we can think of Nux vomica, very important.
Yes, sir. Absolutely.
Yes, great. Any fear of using sepia on the basis of what the, it's not a vibrations, so sepia is not that. Yes, I strain. Okay, fine. But my friend understood that this is something which we called as the remedy which is instilled in the eye. It is for the dilatation of the pupil. So whenever you apply any of the dilatation of the pupil, it is called the atropine drops. Anyone know atropine drops? Yes, Dr. Hazel, atropine drops. So whenever the atropine drops is applied and it get absorbed from the eye and it went into nervous system, this leading to what? This leading to the behavioral changes, this leading to the change in the consciousness, change in the orientations. So do we take directly the belladonna? Is there any remedy rubrics for there? So my friend took the rubric that intoxications atropine from, and he had prescribed opium to that child, abuse of atropine. Dr. Nishant is here. He had given this. Okay. So this is what you have to, that it is not the GCS of that patient. You know, any state remedy come from any of the things. So this is what my idea of sharing, that any acute remedy come from any of the materia medica. Okay, but when you are thinking of a genetic constitution similarium, you can take into consideration the whole. Hope you got the idea. Okay. So starting with the few of the acute cases, already I had mentioned the cases verbally, but looking into this few acute cases, what we have to understood, we have to understood the aphorism number 153. So bear in mind, my lecture would be of theory, practical applications. So this is what we are dealing with the each and every things. So in aphorism number 153, we have to understand SSUPS, singular, striking, uncommon, peculiar, and strange symptoms. And in Dr. Vijaykar's terms, we call it is a syphilis. So aphorism number 153 is nothing but it is the understanding of the syphilis. Syphilis can be a singular, syphilis can be a striking, syphilis can be uncommon, syphilis can be peculiar, syphilis can be strange. The syphilitic symptoms entry point for the case. So whenever you have this, you have to take into consideration of these 4 points. Okay, I'm not going much into detail of that. So in acute case, we have always that there is a exciting cause and all the symptoms is very evident and most striking. Okay, so very evident and most striking are the cases. So you have to keep in mind that any symptoms the patient throw into your clinic during acute phase, you have to pick up that things and apply that symptoms into rubric form or apply the remedy. So that is what the acute is. How can we understand acute? In aphorism number 6, what Master Hahnemann says that there is a change in the body and the mind. We can notice the little deviations either felt by the patient. The patient says something, patient experience something, patient gives you a sensation in the form of something, and then I will give you one example of the case in this so that you can understand this line very precisely. Second, remark by those around. So the first case which I share with the acute fever with the history that the cousin child has given, that this child was frightened by the dog. So that is what the remark by those around. And the third one is observed by the physician. So we have to keep vigilant to understand what is the striking symptoms is. Again, in aphorism number 82, it was written that whenever there is acute conditions or rapidly developed disease, so the symptoms which strikes us is evident to the senses more quickly rather than we have to find it out. Okay, so that is very important. So Sorik, let's have some video so you can understand this, observe this, and then we have.
अरे यार मैं अपना तो फोन ही भूल गई। मेरा फोन यही रखा था।
फोन भूल गई? और तुम्हें पता कैसे चला?
व्हाट्सएप पे मैसेज आया था ना।
और मैसेज कहाँ आया?
फोन वो जल्दबाजी में भूल गई।
So what you understand from this video?
Sir, she is hurried, sir. Out of hurried, she forgot what she is doing.
Okay, fine. Then what you understood? Absent-minded, absorbed in work, hurried, forgetfulness, anything else? Confused, forget everything, busy when, very good. So I had a lot of doctor which gives you a rubrics, very good understanding of unobserving, very good.
Sir, absorbed, sir. Absorbed. She is thinking about one thing. That she is hurried about that.
Okay, hurried, absorbed. Then what you understood from this observation? Can we repeat this video? Anyone? First and foremost thing, we should be a very vigilant physician to observe. Okay. Many a time what happened, the patient comes to us, patient giving you striking symptoms. And what we are doing same like that lady. Absent-minded, absorbed, forgetful, unobserving. Are you getting me? This is what I purposefully put this video for the physician only, not to observe this lady, but in terms of physicians, when you are a physician practicing in your practice, you have to be very vigilant to observe so that you can understand this thing in a better way. Hope you got it. The idea of not getting the rubric from this, but this is what you have to keep in mind. So someone asked to repeat the video.
अरे यार मैं अपना तो फोन ही भूल गई। मेरा फोन यही रखा था।
फोन भूल गई? और तुम्हें पता कैसे चला?
व्हाट्सएप पे मैसेज आया था ना।
और मैसेज कहाँ आया?
फोन
Absolutely foolish. But this is what all the rubric comes to physician only. Because if physician is not observing properly, then it can be a forgetful, it can be a absorb, it can be absent-minded to get the symptoms from the patient. This is what my aim is, that I am not getting any remedy for this lady or that boy. But this is what we have to understand, that our observation should be so sharp enough that we cannot miss any striking symptoms from the patients. Hope you idea. So I'm sharing one of the case with you, a very short case. A middle-aged man came with the complaint of pain in the mouth and showing that there is a small aphthae in the mouth below tongue since 2 days, and it was a painful. No other history is there, just is like this. Look at this in the image. The image shows that behind that teeth there is a small aphthae, a very small aphthae, and the patient is presenting with this complaint, and patient has only these symptoms. So how to give remedy into this case is, or how to apply? This is what the observation is. Any guesses? Just only this history.
Borak, sir.
What is this?
Aphthae.
Might be pan supari injury, yes. Mouth aphthae, tongue below, yes. Aphthae small sore, yes. Very good. Fine. So Dr. Farhan has cracked the case, because this case is shown in my YouTube channel also. He had seen that. So in that case, what I did is I took the observation only, and the observation is this. The rubric converted, observation converted into rubric. What he said, that it is painful. So very small and painful, it is a PQRS. Okay, and aphthae specifically location is there under the tongue. So this shows that this is what the remedy is, madorinum. Okay, so on the basis of these observations only, because I am a clinician in a too busy practice, I just have to prescribe very fast enough. So that I just took these two rubric and prescribed, and within 2 days, absolutely normal. Okay, so this is what the importance of observation. Second case, so we are going little bit fast in this case so that we can complete whole the sessions within a due time. Same case, another male came with the complaint of there is a aphthae on the tip of tongue, and there is a aphthae below the tongue, and it is also painful while eating. No other complaint, and the case is closed. What could be the remedy?
Bryonia, sir.
Bryonia. Okay. What could be the rubric for bryonia?
Mouth aphthae, tongue tip.
Mouth, aphthae, tongue tip. Only bryonia is there, or there are many remedies?
It's many remedies also. Hemamelis,
So why only
lacasis.
bryonia? Why only bryonia?
Yes, sir.
Is there any dryness on the tongue? Is there a
No,
dryness
sir.
in the mouth? There is a lot of moisture in the mouth. Can we think of bryonia?
No, sir.
Okay, that's great. Fine. So same things, I apply observations. The rubric is aphthae tongue tip, aphthae tongue under. The same remedy comes to is madorinum. Now what I learn in clinical practice, whenever the patient comes with this this type of, yes, there is a red tip, but there is a aphthae on the tip, Shekhar, is under the many remedies. Okay. So I learned something in my clinical observation. Then whenever you find that the small aphthae which is very painful and which is on the tip of tongue or under the tongue, the first remedy comes into your mind is medorinum. As rightly said by one of the doctor that it is a deep acting remedy, but what I said you, whenever you are dealing with acute conditions, you can apply any damn remedy which is deep acting in acute case and it can only reverse the physiology, no other thing will happen. So this is what my clinical experience teach me. Okay, fine. So going further, another case of the female having infections in the hands and finger. So it was a 20 observation is most important. So I am just putting way in a very fast way. 27 years female came with the complaint of eruptions on the fingers and palms since 4 days. History of chronic eczema over fingers, which comes and goes since many years. She had infection since 4 days. Pus is discharging, sticky, no itching. She is chilly and thirstless. On the basis of eczema and her whole history, I had prescribed natramur and calcareous sulph, but she did not relieve. Then I selected one remedy by observations and prescribed 3 doses OD and SL for 15 days. Within 15 days, absolutely normal. So we'll share with you a photo and you have to observe it. Okay. So it was a before photo. Look at this. What you observe in this case? What type of eruption is? What is the diagnosis? What type of eruptions? And what remedy you can think of or what rubric you can think of from this. I will show you another photo. This is the second photo of second hand. This is the third photo. So repeat this. Okay, this is the before. Yes.
Pus in
Very good. Eczema pustular, creosote, Bharat Reddy, absolutely good. Pus below scab, very good, Azil. Developing cellulitis, possibility, yes. Heparin sulph, blister type with the cellulitis if sensitive to pain, and very good, fine. Looks dirty, absolutely. Pus in the pocket, eruption scarcity with the pus underneath. The remedy Psora, Miserium, absolutely. All are good and genius. I had read one book of Robin Sharma in which it was written that everyone on this planet is genius. So I may consider all of you are a genius and you reach to the right remedy. Absolutely. So the things which is in the first photo, you can look at this. This first scab, I had removed the scab and then I found this. Before that it was like this. Okay. So this is what the PQRS somewhere written in our Boric Materia Medica. So I will show you that. In Miserium Boric Materia Medica, it was written that eruptions ulcerate and forms thick scab under pleural matter exudes. The two remedies are there, Miserium and chrysopanic acid. So this is what my clinical observations. I prescribed Miserium to her, 203 doses, and this is the follow-up. Look at this. This is the follow-up. All the ulceration went away, the psoric eruptions, a dryness, and the mild scaling and itching. The second hand was absolutely clear, and the third finger was absolutely normal. So this is what ulceration lead to the simple dermatitis. So reversal of miasm as well as, so by observing these things, you can get into a remedy. Okay, let's have another way of understanding. The first things which still we are dealing with the acute cases.
Hello,
We
sir.
are dealing with the acute cases. Yes, Dr. Arthi, are you saying
Yeah.
something?
Yes, sir. I have a query if you don't mind.
Yes, yes, yes.
Sir, in this previous case of Miserium, you had prescribed Natramur and CS
Yes,
as the previous constitutional medicine.
yes.
So, as it was a chronic case, so in that we obviously moved with the GCS.
Hmm.
But in your case, what you said is that the two medicines did not work, and hence
Hmm.
you had to switch to this other medicine, that is Miserium, which worked beautifully. So, how
Yes,
do we decide in the case? Because many of our times, what happens is that the patient do not give us so many opportunities that they would come up and we can come up, so, like, how did you decide with how did you not come to this conclusion that we should go with the other medicine, Miserum, in the first terms, and you went
yes,
for the GCS and it did not work,
yes.
as the way you thought it. Thank you.
Absolutely. Very good question, Dr. Atif. The things which I shared previously in the slide, you missed that I have to be keep vigilant on SSUPS.
Mm-hmm.
Whenever you find any singular, peculiar, uncommon symptoms from the patient's point of view, and you applied on the basis of that, that covers the whole. That is what I understood from my clinical practice. And I failed in many cases and then apply another applications and then I get the result. So this is what I learned from this. So the Natramur as a constitutional did not help. Constitution Calcarea sulf as a constitutional did not help. I consider Natramur and Calcarea sulf as a constitutions. Actually, the patient is not Natramur and not Calcarea sulf. Are you getting me?
Yes, sir.
So that the PQRS patient is giving you self-evidently that the skin symptoms, the cell is showing you a PQRS, the same constitution is like this. Because cell
Okay.
and the person is not different, the both are the same. That's why I prescribed Miserium 3 doses. She is absolutely fine. This was a case in 2011 and after it is running now 2020-25. She and her family came to me. She never had that again skin complaint since 15 years. So this must be a GCS of her. Okay.
Right, sir.
So
Right, sir.
that is what the things which I learned from my practice, that don't consider that, because the remedy which does not act on the patient, that means throw away that remedy, that is not matching with the constitutions. You have to take into consideration the PQRS, SSPUS, aphorism number 153. Okay. Hope
Okay, sir.
you got the answer, Dr. Atif.
Yeah, thank you.
Okay. Let's see another understanding. Do you wish to repeat the same video to observe the patient or observe the persons? So I will repeat that.